A global enemy that leaves no life untouched. Coronavirus threatened to be worse than World War II, wreaking havoc in all facets of our lives, from school closures to devastated industries and millions of jobs lost. The social and economic costs of the pandemic are many and varied. COVID-19 is threatening to widen inequalities everywhere, undermine progress on global poverty and clean energy, and most importantly, the loss of numerous human lives is one thing we still struggle to digest.
The Gambia, as a country in West Africa, was not exempt, as you correctly point out, from the impact and the ravages of the COVID-19 pandemic. We had a very high number of individuals who were infected with the virus. We had a very high number of individuals who passed away because of the virus. And not only that, the pandemic had a tremendous impact on the ability of children and adolescents to continue going to school. The agricultural sector was also affected. The tourism sector was also affected. So the Gambia was one of the countries that registered a lot of significant negative impacts. This is one of the reasons why, from the very outset, we advocated for the Gambia to be one of the first countries to receive vaccines.
Social Change Factory, through its brainchild, the Jambaar Corona Solution, set in to mitigate the effects and spread of the coronavirus in the Gambia, worsened by misconceptions, myths, and disposition to get vaccinated. Coronavirus threatens in a new dimension as the virus mutates to create new, more transmissible variants like the Delta and Omicron strains currently ravaging communities around the world. Vaccines are highly effective for curbing the spread of COVID-19, reducing hospitalizations and saving lives. Yet, a large percentage of Gambians remain hesitant, with thousands still not vaccinated against this fatal virus. Vaccine supply is widely reported to exceed demand, with conservative, rural, and younger populations expressing greater COVID-19 vaccine hesitancy.
Vaccination, as people thought it is not the way it is. Understand? This is something that will help your immune system to be boosted. So the importance of the vaccine is to make sure that our immune system is very strong to fight any other infection or disease that comes our way, being it the COVID or not. But people have the perception that if you take the vaccine, it is not good for your body. And then I want to just rest assure with them that this vaccination is being confirmed. Our health system is very good, and then if they know that any vaccine is coming to the country which is not good, I think they will rest.
Like comme ñu fi nekk ni xam nga am na ñoo xam ne sax jëluñu woon péngu bi. So through here comme gars suñ leen explainalé dinañ mëna tax gars mëna jël vaccine bi.
Despair of a rapid change begins to flare with the strides of unrelenting partnerships of like-minded institutions, with young people at the fulcrum of affairs representing National Youth Council, Ministry of Health, and Center for Sustainable Development. The team, through a joint blueprint of a working document, established a framework to implement the Jambaar Corona Solution project across all regions of the Gambia.
So the first activity was actually a workshop to develop a toolkit that we can use to do trainings of COVID-19 in the Gambia. And this, for the first time, we were able to bring together different stakeholders from the National Youth Council and of course from the Ministry of Health, from all the regions in the Gambia. And then we had a successful day wherein we were able to develop a toolkit we call the manual for the Jambaar Corona Solution activity.
We really enjoyed the partnership we had with the Social Change Factory in also ensuring creating awareness on COVID vaccination, reducing misconceptions and as well as rumors around the vaccine, and also encouraging people to take up the vaccine. So this is something that we have really enjoyed, the partnership between the Minister of Health, that's the Health Promotion and Education Directorate, through the risk communication and community engagement, both at the national level committee and also the regional level committee. We've really enjoyed working with social partners in raising awareness and also building the capacities of volunteers, the youth volunteers, and also community structures, and also all other interpersonal communication networks in ensuring that we promote the utilization of COVID vaccination across the country. So that was something that we are happy that we are part of the team. Your organization really was very much important in trying to participate, especially when we started participating in our daily briefing meetings, and then that was really helpful. And that we were able to know what social change parties were doing with regards to raising awareness. So that is something that we feel is a very important thing, because FNC cannot do it alone. We have our structures at national level. We also have our structures at central, regional level, and also down to the community level and district level. But this is something that if we have a partner that also have a competitive advantage in trying to reach out to the volunteers, especially youth volunteers, it is something that has been cherished, and that we really enjoy that partnership.
Since our partnership with the social team country, I think our key role as a council has really been when it comes to mobilizing our young people for purposes of training, if not for training, for purposes of mobilization, but really ensuring that the manpower that is needed, or the numbers that are needed, or the structures that we have in our region are well utilized. We are able to really deliver. It's obvious that as a national institution, we pride ourselves as being the most sort of widely represented institution across the country. And we have our regional youth committees, our district youth committees, but beyond that we also have our registered.
Yeah, I guess this is a very good initiative in a sense that we have been having workshops or platforms like this, but I think this Jambaar project, the platform that I've seen inside, is very, very good for the fact that majority of the youths in Banjul are called.
The second activity was the training of youths and adolescents on interpersonal communication of COVID-19 prevention. This activity consisted of training 1,000 young people and adolescents living in the 7 regions of the Gambia. The training was held in each region for a day with the involvement of the regional health promotion and education officers and the regional youth chairpersons, with a monitoring team from SCF and NYC. In each region, the regional youth chairperson was responsible for the mobilization of participants and served as a resource person alongside the regional health promotion and education officer.
What we do is, when we have selections to do, or when we have activities, the mobilization, the way we do the mobilization is through contacting the constituency chairperson. So to do any mobilization, we just call the constituency chairpersons to help us in the mobilization. And to extend our mobilization also, we also consider some youth organizations. We send them invitations, then they send us their representatives.
The council works with young people, or whatever we deliver, we are certainly delivering for young people. And certainly the Jambaar project under the social change country is also equal, looking at innovative solutions from our young people, addressing societal solutions. So I think it's a great partnership that we have with social countries, considering the fact that we are delivering for young people and really harnessing the potential that we have in them. So I think since as a country we are aware, we will continue about the social country.
So the importance of this project that we're undertaking in the Gambia, thanks to the very generous support of the United States Agency for International Development, USAID, is to focus on the roots of vaccine lack of acceptability and to focus on the roots of vaccine lack of uptake. And the way that we do that is by focusing through this generous support on prevention of COVID-19 response and vaccine rollout and uptake. But to do that, you need to know who to work with. You need to know who your targets are. You need to know who are your critical populations that you need to engage in this activity. And from the very beginning, we knew that the high level of vaccine hesitancy in the country was related to a lot of misinformation. right? So the misinformation needs to be targeted with accurate, up-to-date and timely information. And in our view, who best to do this with than with youth, community engagers and mobilizers. But at the beginning and at the outset of the project, we started to ask ourselves, who can help us in terms of working with young people to engage them as powerful members of their own communities. People know them, they trust them. And we came across an organization called Social Change Factory. And Social Change Factory has a lot of experience in this part of West Africa, training youth in different areas of social mobilization and community engagement. And through them, what we've done is to be able to train more than 1,000 adolescents and young persons in skills to mobilize and engage communities. How did they do this? First of all, they had to craft and develop the messages. What is a message that I want to take to different members of the community vis-a-vis vaccine acceptability and vaccine uptake? Why is this so important? Because in the world of social communications and behavior change, segmentation of your message is fundamental. So a parent, and above all, a mother, might need different pieces and different categories of information than, let's say, traditional religious leaders or community leaders or even local government officials. So first and foremost, working with Social Change Factory, they were really good at doing the segmentation of the message. And from there, doing the capacity building and the training of the youth mobilizers and community engagers. And once we knew the dates of the COVID-19 vaccination campaigns, putting them out into the field to take the message, the vaccines are available, the vaccines are safe, and if you decide to get vaccinated, the level of protection that you're going to generate against the virus will be very high.
The third activity was a training of youth and adolescents on interpersonal communication on COVID-19 vaccination. Following a successful training of participants on the Jambaar Corona Solutions project, focus shifted to the vaccination phase. This has seen over 1,000 participants, again, but this time from Western 1, 2 and the North Bank regions, engaged and sensitized their various communities on the wrong myths and misconceptions about COVID-19 vaccines. Lack of sufficient knowledge has been key to standard myths that led to the high level of vaccine hesitancy. With a coordinated approach that has seen the vaccination of participants at the training sites accompanied by our vaccination team from the Ministry of Health led to positive turnouts for vaccinations in various communities. This activity was met with a high level of proactiveness and interaction by our partners, participants, and most importantly, high communal responses to the messages and objectives.
Da nga xool différence bi si ku jël vaccine bi ak ku jëlul vaccine bi comme yaa ko gën a strong feebar bi su ñëwee si kooku la mojo, so it is very important pour nga jël vaccine bi.
The fourth activity was the street marketing, national caravan, traditional communication campaign, and the house-to-house sensitization. No one is safe until everyone is safe. Thus, after undergoing 2 separate training sessions on interpersonal communication on COVID-19 prevention and vaccination, the participants embarked on community engagement through a systematic caravan and house-to-house campaign. The aims of these activities were to clear the myths and misconceptions surrounding the COVID-19 vaccines, ultimately encouraging vaccination during the vaccination campaign, owing to the fact that our societies lost a lot to COVID-19 pandemic.
We're very happy with the results of this particular campaign and our collaboration with Social Change Factory, because we've seen that between this current campaign and the one that came immediately before, the uptake has significantly increased. And we consider that one of the reasons for the significant uptake was fundamentally investing in messaging, investing in social mobilization, and investing in really attacking the root causes of vaccine disinformation and misinformation that we have in the country.
A breath of relief after the engagement with over 4,000 youth and adolescents trained on interpersonal communication on COVID-19 prevention. Through a well-coordinated and executed nationwide caravan and house-to-house sensitizations, the team was able to reach out to over 10,000 people in over 50 communities. In response to this, the energetic youth and adolescents of the Western 1, 2 and the North Bank region took up the responsibility of peddling the regions to more COVID-19 free communities. The trained participants indulged their communities in dialogues to convince the vaccine hesitant to partake in the vaccination for the good of all.
I just want to emphasize again that COVID vaccination is still ongoing, and then we want the public to come out in their numbers and to get vaccinated. COVID is still around, so therefore we want to encourage people to get vaccinated. The misconceptions and rumors around the vaccine, let them throw it away and let them listen to the technicians, and technicians like Social Training Factory, the Minister of Health. The messages we are delivering to them, that is the message we want them to adopt so that we can be able to get the result of the COVID we want for our country.
COVID is real and it's still existing. And it's important that as young people we ensure we are vaccinated.
Join us in this effort because it's good for the Gambia to get vaccinated.
So Social Change Factory has taken a step already, and remember, this is a collaborative effort. It does not stop at one end. We've done our part. We are expecting everybody out there to do their own part, together against COVID-19. That is the goal.
Through this approach, we will collectively attain a COVID-19 free Gambia. We applaud the determination and commitment of our youths to serving their communities.